Well, as you know, we have the launch of the first of 4 monoclonal antibodies against CGRP for migraine prevention in the United States on May 22nd, just last month. It's a little bit early to know how it will work, but we have a lot of data from the trials, and I must say it has created a lot of excitement in the United States. And the reason for that is, as we know, we have several preventive medications for migraine, and we've had them for many years. We have beta blockers first, and then we have calcium channel blockers, which we really don't use so much for migraine prevention. And then we have the anti-epileptic drugs, and we even have some other anti-blood pressure drugs, like the angiotensin receptor blockers. And all of these drugs can work in migraine. They are difficult to use as preventives because you need to take them once or twice a day, and they have a lot of potential adverse events or side effects. And the data is that if you try to keep someone on a drug like topiramate for 1 year, the chance of them still being on it after 1 year is about 20%. And these are reasonably good drugs, but they're very hard to use. That's the reason we're very excited about monoclonal antibodies, because they can be given once a month or once every 3 months. They have much fewer adverse events and very few serious adverse events. They have very few contraindications to their use, and they work pretty well. Now, do they work much better than the preventives that we currently have? They work at least as well or somewhat better. The data shows that about 50% of patients will have about a 50% decrease in the number of migraine attacks per month. But some patients have a 75% decrease. And a few very lucky patients might have a 100% decrease in the number of migraine attacks they have. Now, what about the price? These are very expensive therapies. The only one that's been approved so far is the Amgen Novartis drug Erenumab. And we know that one injection, and you need one injection every month, will cost $575. And per year, that's $6,900. That's a lot of money, but we thought it would be even more than that. And what we expect will eventually happen is that the insurance companies will realize that these medications are good enough that they have to help with the payment for this. And that's what we're hoping. What Amgen has done in the United States is say that the first 2 injections are free, no charge, no matter who you are. So at the end of 1 month, we'll have a very good idea of how the patient is doing. And at the end of 2 months, we'll really know, is this a great drug for them or not? And if it's not covered by insurance, it will be up to the patient to pay the money, or maybe Amgen will even help with that. But this is an exciting time. The only other time in my lifetime in headache that we had such excitement was back in the 1990s, 1991 in Europe, 1993 in the United States, when the triptans were launched. And eventually we had 7 triptans, and it was a very exciting time. Now we're going through this exciting time again. So I am optimistic that these new treatments will be good and that many people will be able to use them and that they'll be safe, but only time will really tell us.